Welcome. My name is Marie Gorski, YMCA registered dietitian. Today is our Healthy for Life podcast series. And the topic today is disordered eating patterns and eating disorders in teens and preteens. I'm joined today by a couple of specialists in the field. Melissa Smith is a registered dietitian with the Stevens Family YMCA in Illinois. Dana Baker is a mental health therapist. She is also with Stevens Family Y, and they are the experts in this matter. And today they're going to help identify some things to look for in your teens and preteens, and how you can help your kids get better. So I'm going to turn it over to Melissa first. Thank you, Melissa.
Hi, Marie. Thank you so much. Yes, my name is Melissa Smith, and I'm the Director of Nutrition and Behavioral Health for Milestones with the Stevens Family YMCA. I have been a dietitian for, almost 15 years. And both Dana and I do carry the specialty of working with individuals that struggle with their relationship with food, specifically disordered eating, anorexia, bulimia, and everything within between that. So we are really excited to be here today to cover a topic that Dana and I work together collaboratively on with several clients, as well as with other community physicians, psychologists, therapists in Champaign, Urbana. And I can pass it over to Dana so she can give a very brief introduction of herself.
Thanks, Melissa.
Like I said, my name is Dana Baker. I'm a licensed clinical professional counselor. I specialize in eating disorders, the treatment of with body image, self-esteem, depression, anxiety, self-harm, and trauma. It's a kind of a large umbrella, but specifically have been working a lot with disordered eating disorders, and alongside with Mel for a good couple of years now. So
awesome. Thank you, Dana. All right. So let's talk about a little bit first. Maybe Melissa, could you explain to us kind of how do you describe to our listeners what an eating disorder is?
An eating disorder is a complex mental health disorder. It's a biologically based brain disorder that requires a perfect storm of like genetic predisposition, temperament, and environment. One thing that Dana and I really like to speak to is that we do have several parents that might bring teens or preteens in with suspicion of a disordered relationship with food. And individuals and parents come in with a lot of guilt, thinking that maybe their own comments surrounded around body image was the actual stimulus for the eating disorder developing in their child. But what I like to think about is, number one, it's no one's to blame, right? I like to think about the actual eating disorder looking like a math equation. So it has to do with genetics plus cultural messages, plus like what's going on in a peer group, plus family stress, plus body issues. So that perfect storm of all of those things coming together then can result in this kind of complex mental health disorder. Dana, do you have anything to add to that?
I'm trying to think. We pretty much covered it's just a combination of things. It's not a one specific. Event might trigger something. It kind of might be sparks the entire thing, but there is a lot of underlying factors that go into it. So
yeah, and kind of speaking to that kind of trigger, I mean, it could be anywhere from a growth spurt to an illness that maybe prevented a child from eating solid foods, like where they may have dental work or something like that. It could be hormone changes, puberty. I mean, it could simply be, not simply, I shouldn't say that, but it could be how a teen maybe handles grief or other things.
Mm-hmm. That's, I appreciate that the spectrum is so broad, because I'm sure as parents, well, I know as parent myself, that anything that is out of the normal scope of health you feel like it's your fault. So I think that I'm sure parents appreciate hearing that it's not, they didn't say that one thing that triggered their child's eating disorder. So
no, and I'm kind of glad you brought that up, because one thing we do want to talk about today in the podcast is, parents and family members and peers and everything are a part of that equation.
Mhm.
But so how can our listeners and the YMCA members, as far as being parents, how can we lessen the impact of that perfect storm that we could contribute to it? And so we'll be identifying some of the language that's surrounded around food and different things like that, as well as around our own selves and body image, that could really help. What do I want to say, Dana? Like, lessen the actual onset of the eating disorder.
okay, yeah, perfect. I'm sure, yes, any tips like that for our listeners will be well appreciated. So are there any, specific, when you first meet with a client, are family members coming to you, obviously probably on behalf of their child? What are kind of the signs and symptoms that they're seeing? And then, what do you see to help kind of identify eating disorders?
You want to take that first?
Okay, yeah. For kind of more, if parents are coming in for concerns of their child, usually a lot of it's kind of behavioral, of noticing a physical change in them, whether that's increase in weight, decrease, just overall physical appearance in that sense of, and also just noticing behavior changes with food, their relationship with food, if it's skipping meals, refusal to eat certain foods, maybe avoiding foods that they previously enjoyed once, if they're isolating a little bit more, if they're kind of shying away from, social functions with friends, maybe noticing an increase in irritability, sadness, anxiety around food situations, just overall kind of isolation. Parents obviously know their children best, so it's just that observation and the concern of like, hey, these things have been happening, not really sure what's going on, because as we all know, teens and things like that don't necessarily tell us up forefront of what's going on.
Right.
Dana kind of mentioned that, there's a spectrum of obvious signals that your child or preteen or teen can be experiencing, like that dramatic weight loss or refusal to eat, retreating to the bathroom for long periods after meals. But there's also those like subtle things she also kind of interwove within that. And I kind of want to speak to the physical changes that can happen.
Perfect. Yeah.
So, if you've noticed more hair on the bathroom floor. So with an eating disorder, our body really does its best to keep running and to keep all of our organs functioning. And often you will see, if there is restriction happening, you will have an individual that is losing more hair, or there could be more hair present on one's body, such as on the face and on their back, little bitty tiny hairs that end up popping up because there probably has been a decrease in consumption from calories and body weight has changed. And that's the body's natural response in order to keep the body at a specific temperature. And then you can go from even just kind of looking at your child's nails. So brittle nails, if there's constant complaints of being cold, if the individual is female, then loss of menstrual cycle, anything that is abnormal. When looking at your child and you say, they don't look like they feel well. So glossy eyes, changes in clothing. I think that's something that's really important. If there is an individual that typically wore more fitted clothes or normally fitted clothes, and then that teen or preteen decides that they're wanting baggier clothes. I also kind of like to remind, like, any change in like a child's breath, like noting those things, because hormonally things can shift to where you notice a different scent from that. As far as other kind of behaviors that you might notice there could be some calorie counting happening that wasn't present before, difficulty eating foods with others, especially if there's difficulty eating foods without the knowledge of what calories in. So then you start to notice that like isolation piece. Yeah, that's kind of
So
where
kind of more attentive to what they're putting in their mouths, where maybe they hadn't been like that before, could be one potential indicator.
Yeah, I mean, there's so many little things that can be happening that Dana and I really want to encourage parents to not overlook. If you have that intuition that this is a different behavior, more food is being left on the plate. The teen is walking out of the house instead of having their typical breakfast that they have done repeatedly over and over again for half the school year with maybe a banana in hand. And just kind of having, as Dana puts it, how do you say it?
The caring curiosity.
Caring curiosity. Ever since Dana and I have worked together, she's always said that. And as a parent myself, like, I feel like that's a really loving way to look at it. And so coming from the point of I've noticed and, you know, I care about you. So just want to make sure that you're getting enough fuel for your body. And that can really help lead into conversations.
I think that brings up a great question, is, you know, how do you, and maybe I'm jumping ahead, but, you know, how as a parent or caregiver, do you approach your child? How do you go to your child first with, you know, in a loving way, or do you go to their pediatrician first, or, you know, what are kind of the next steps if you're feeling like something is off, you don't know what it is, how do you, you know, what's the best way to proceed?
I think working with families, and I think the best approach is not to discredit or invalidate, you know, depending on how old your child is, if it's a teen, preteen, just not to kind of brush off like it's just a phase, they're overreacting, they're being too sensitive, or in that sense, and to take things, you know, pretty seriously if you do notice behavior, you know, a simple, you know, fight in a peer group or a breakup, you know, to them that might be seen like life changing and life ending for them, and to you as a parent it's kind of like, oh, like they'll get over it, blah blah blah, like, you know, just give it time, versus validating like this is a really hard time for you, I'm noticing, you know, you're really upset, you know, you can talk to me. And just creating that open communication with your child is super important, because it gives them the comfort and that safety feeling that they can talk to you even though they don't always want to. It's just giving that open door policy of like, I'm here to talk about anything, I'm not here to discredit how you're feeling in that sense. So in the kind of from a parent perspective and being a parent myself, you know, it would be of like, hey, I've noticed you've been, you know, not yourself lately, you know, you've been a little more sad, or you've been kind of spending more time in your room, you haven't been spending as much time with your friends, or academic performance has kind of increasing, like your grades have been kind of falling. What's kind of going on? I'm just wondering, you know, I'm just noticing these things. Can you tell me, like, kind of fill me in, you know? And, you know, if they say like nothing or I'm fine, it's kind of like, well, what does that look like? Like, what is, you know, kind of digging a little bit deeper of like, what is fine? You know, what's not fine look like, you know, and it's giving them the space to like, kind of put it into their own words. And, you know, it is sharing that, you know, you're caring and that you're just concerned, instead of kind of either invalidating, shutting it down, or, you know, just being not as, you know, as open with. That's when kids aren't going to come and talk to you about just anything in general. So then if it's, you know, if it comes to a point where, you know, you do need to talk to your pediatrician, you know, maybe seek additional help and support of therapy, a dietitian, in that sense, but it's always keeping them in the loop. You know, no one ever wants to feel talked about, or, you know, in that sense, it's like, hey, this is what we're going to do. We're going to call this person. Do you want me to go with you? In that sense. So it's always keeping that communication open.
I do think from a pediatrician standpoint, that often is like the first go-to as a parent. And I really want to say, you know, tread with that lightly, or perhaps if you can go into the pediatrician's office prior to the teen or preteen coming in and make them aware of what the appointment is about. because at those appointments, there can be things that are triggering if you are suspecting that your child is suffering with disordered eating, relationship with food, and so on, body weight and shape issues. Yeah. And so when you go into a pediatrician's office, typically the first thing that they do is weigh your child. And that can be very triggering, very shameful experience for someone that is struggling in this way. And just to note out there, you can always refuse that. No matter what. It is not an obligation that your child be weighed every single time. It is not an obligation that you need to be weighed every single time. And so just note that you do have that right as a human to say, you know what, I'm okay today. If the doctor absolutely needs that for a medication change or something, that's something that we can discuss. And you can do that on behalf of yourself and your child. I also think it's very, very important to understand that the pediatrician that you may be going in to work with understands eating disorders and understands bedside manner. And so just to make sure that you have someone that you're going to be going in to seek information with that can either give you information about a therapist and a registered dietitian that do specialize in this area, but then also where a pediatrician is extremely helpful is recognizing the physical and biological health of our children, right? If there has been a dramatic weight loss, also maybe requesting labs being drawn to kind of see, what's going on. Why does my preteen daughter no longer have her period? Should I be checking her iron levels?
Allergy or something?
Yeah. What is happening? Yes, going on, as well as like taking a look at vitamin D levels and different things that really can affect a person's mood. It can affect their energy level. So we could be investigating for a disordered relationship with food, but there could be something else going on too. So always entering it with very like inquisitive point of just like, I'm not really sure, just my motherly or fatherly or whoever the caregiver is, intuition is telling me that something is wrong and I just need to find support for my child.
Mm-hmm. Yeah, I agree. I feel like too, Dana was speaking earlier about speaking to the child directly first. And I from my schooling, what I know of eating disorders is that it's a sense of control. So it's something, maybe when a person is feeling out of control, it's something that they can control. So in that instance, allowing that individual to speak to you and let them know that they're part of this equation, probably, I would assume, allows them to still have some control over what's happening in their lives. Do you feel that that's true?
Oh, absolutely. I mean, and honestly, it may be, I don't want to go to the pediatrician. I would rather go speak with someone. So really allowing the teen, preteen to have some sort of say, and they may not want to discuss what's happening right now in this moment.
Mm-hmm.
And that's also okay, unless you're fearing that the individual may be wanting to self-harm or harm themselves or in some way. Then we need to get them help and attention right away. However, a little space and always leading with the I've noticed and I feel, rather than why are you doing this? You didn't do this, sort of approach. It can often be way more receptive to any age of human, right?
Sure.
I know one thing that Dana and I kind of brought up in the beginning of this, wanted to speak about is I kind of gave that equation of how that perfect storm happens that could yield an eating disorder or a disordered relationship with food was what role do we as parents, family members, peers, what do we play in all of this? And like, how can we maybe change how food is viewed and interacted with in our body, as well as like how we view our own body? How can we change that in order to have a better atmosphere and relationship with our body and food? And Dana, do you want to cover some of that?
Just kind of like the home environment and things like that. Just first of all, when I work with parents and families, it's just noticing how food and body is talked about in the household. In that sense of if you're placing labels on food as good, bad, healthy, and healthy, or if you yourself are on a diet or shaming your own body for looking a certain way. Our kids pick up on that, and they are very observant, even though you're not directly shaming their body or criticizing their body. They pick up on if, mom feels this way about her body, what do I feel about mine? Or I can't eat this things because mom doesn't eat it, she's on this diet, or I should try this diet because it makes mom healthy. Or having separate dinners because you can't allow yourself to have what you made your family type thing. It's all these different things in the household. Like I said, labeling healthy, unhealthy, deeming dessert as earned. You have to finish your food on your plate in order to have that. All these different food rules that, we probably heard growing up from our own parents and grandparents in that sense. It's not directly, at them, but they're picking up on these things. And from a very young age, they're very observant and they internalize that very much. So it's starting out in the home environment, how you view your food at home, mealtime, what that looks like, in that sense, because our kids are exposed to numerous messages in our diet culture that we do live in. And, the one place that hopefully they can feel safe and not feel judged or feeling unvalued or that something's wrong with them for their body should be in their home environment. It shouldn't be, at the table. It shouldn't be discussed. It should be a place where all food is looked at as an even playing field. We exercise because it makes us feel good and it's, makes us feel strong in that sense. So that's a big thing I always encourage parents or caregivers is to look at their own relationship with food in their body and how they are projecting that in the home environment.
Yeah, I can add to that, Marie.
Yeah.
From a pantry or grocery perspective as a registered dietitian, just making sure that as a family that all foods are considered equal to some degree and that all foods do fit. I think leading with that and not making sure that candy is only for Fridays and that we can only have this once a month, those types of things, and that your pantry is full of just tons of variety and not taking the candy and the cookies and all the things that are kind of socially deemed as unhealthy and hiding them away, because that actually gives food greater power and causes children, adolescents, teens, and preteens to actually want that more. And so basically allowing everyone in the house undeniable permission to eat whatever they like. We are all born with this amazing navigational beacon of hunger and fullness. The intuitive eating side, Dana just mentioned that side of things is amazing. And the more we as parents or as for our own self try to control what comes in and comes out, it really starts to dampen the signals of hunger and satiation. So there's probably a lot of listeners out there being like, so you're just telling me I need to let my child or preteen fall face first
It's a free
into a bag of M&Ms, right? And I mean, honestly, I am saying trust your child, right? Trust your child.
Trust their intuition, their body, their hunger, their fullness.
Because it would be very interesting if any of you out there have a 2, 3, or a 4-year-old, and you guys have birthday cake or something. And if you cut a small piece of birthday cake for your 4-year-old and your 4-year-old's then I want more birthday cake. Well, sometimes the natural mom, dad, whatever thing to do is to say, no, you've already had enough. That's enough. I just ask you to challenge yourself to give them another piece of birthday cake, because what's the worst thing that's going to happen? They might eat one bite and run away and go play, but this is just teaching them to follow their hunger, their fullness, their satiation, and to understand that food can be celebratory, but it doesn't put that food on a pedestal that is a very small portion and that's it type of food, which all starts kind of developing that relationship that could become negative in the future.
Yeah. That's an interesting point. And I assume when you both do your counseling sessions, it is a group effort with the family or the caregivers. You're not selectively just working with one individual of the family, because that would presumably be a whole lot less effective than kind of doing, looking at the interconnectivity between families and caregivers and friends and how we all contribute to someone's eating patterns, right?
Yeah,
It is a
totally.
family affair.
For sure. You know, a lot of
We'll
times,
slide a family stone here.
yeah, a lot of times in the beginning, if Dana and I are sharing a teen or preteen, you know, Dana does really focus on being that teen's sole support. And I, as kind of step outside and kind of take a look at what's going on from a family perspective of the world of food. And from what Dana can gather from client and remain totally aligned with client, then we can kind of work together to help cultivate a just overall in general, a healthier environment, to make sure that the place where that teen or preteen spends the most time, it is the best place for them to be to like rebuild that relationship with food and self and body.
Mhm.
And just want to reiterate, it's never the family's fault. It does take that complete storm of events to happen. But there are things that we can really work on as parents, such as our own judgments towards ourselves, towards body shape and weight, what we allow ourselves to have, and the way we speak about food. Food should be fun. Food should be enjoyed. There should be foods that we eat that are really nutritiously dense. And then there can be those foods, which I love, which we have like a pound bag of dark chocolate peanut M&Ms that I'm always chowing on too, right? And so I just really appreciate your time and letting us come on to this podcast. And
Yes, thank you so
we'll
much.
be providing you with materials in order to, if a family is really worried about one of their family members, their teens or preteens, that may be struggling with food or relationship with body, we'll give you some information so that you can give that out to your listeners.
That would be wonderful. Yes, for all our listeners, we will be this podcast is being recorded, and we will have some literature available as well, with some resources for families, about next steps, when things to look for, kind of, you know, a little brief overview of what Melissa and Dana presented today. And so yeah, thank you both. That was super interesting, and I think a very important topic for, you know, our families, our Y families out there. I think that I'm sure I'm curious to know, but over the last couple of years, have you seen an influx in cases? I know a lot of kids have been affected by the pandemic, having to, you know, go to school remotely, and things like that have been a little more isolating. So I'm sure the time is now where there's a lot more cases, unfortunately. So definitely good to keep the eyes open now more than ever.
For sure. Yeah. Anytime there is isolation, whether it be forced or the actual person is isolating themselves, it does actually kind of go into that equation of that perfect storm for either we're talking about eating disorders, but then just also like mental health and keeping our mental health as healthy as it possibly can be. Because we all have mental health, and it's on a spectrum. And some days we feel amazing, and some days we don't feel so great, and some days are really, really crummy. And having an outlet like a therapist to come and speak to is very, very important. And also just making sure that that seems very normal within the family. To go and speak to someone about what's going on in your life is a very normal process, and it's not scary. So we're here to help if anybody needs any information or connection to care. I know we're in Champaign, Illinois, and y'all may not be close to us. However, we can help find you a provider or answer any questions you may have regarding mental health, nutrition, and eating disorders, or anything and above.
Perfect. Yes. And in our Gateway region, we have just this week hired part of a new member of our community health team, who is she is a health navigator. So she can also help with resources for families as well. So thank you so much, Melissa and Dana. This has been amazing. Really appreciate your time. I know our listeners will appreciate it as well. And we will see you again on the next episode for Healthy for Life, and look forward to our next monthly installment. Thank you so much.
All right.